Being a doctor is stressful in itself. Being a doctor and dealing with a disease like cancer, a mental health issue, or HIV may make that burden even more difficult to carry. My name's Ed Pilling. I'm 41 years old. I'm an anaesthetist at the Princess Alexandra Hospital in Brisbane. I'm a gay man and I'm HIV positive. I practiced initially in the UK before I moved to Australia in 2010. And I've been working as a consultant anaesthetist at the Princess Alexandra Hospital. And recently I've also expanded my practice to some private practice as well as my public post. So I received my diagnosis of HIV standing in the anaesthetic room outside of the theatre of the hospital I was working at the time. The reason I received the diagnosis was like this was an error on the part of my GP, who had emailed me at my request the results of my sexual health screen, which was an entirely routine thing, and not realising that the HIV test result had been sent to the reference lab for confirmation. There was a 99% certainty that I was HIV positive because the only reason for sending a test to the reference lab is confirmation of a positive result. It was a really scary moment in my life. I really didn't know who to turn to, essentially. As a gay man in a profession such as medicine, which can be quite conservative, it's very difficult to know how much of yourself to reveal to other people. It's very difficult to know which people are essentially silent homophobes and which people are open to embracing you as a person as well as a doctor. At that moment, I did feel very, very alone because I'm not in my home country. Many of my really close and long-term friends were still back in the UK, including all of my family. And I was really scared about what this diagnosis meant for my career. So I was referred to a medical specialist who actually happened to be the head of infectious disease at the hospital I was working at, which was actually quite a good thing. So he was able to quell a lot of my fears around my career and what this diagnosis meant. And I was started on antiretroviral treatment. The problem with that was I was started on a drug called Atripla, which is a combination of 3 medications. I actually took the first dose of this medication while I was on shift, not realizing that it would make me feel essentially drunk. I didn't know what to do because I couldn't tell anyone because that would mean revealing that I was HIV positive. This is on the back of also being scared of getting a Sharps injury and having to go to infection control and reveal that I'm HIV positive, not knowing what there were all these fears going through my mind about losing control of this piece of information, which, essentially I was still very ashamed about and very scared of. And it was a really hard and lonely period. But I basically worked all these things out for myself. I like a lot of doctors, struggled to ask for help. And I didn't know who I could trust. And I know that there are other HIV positive doctors out there, but I don't know any. It's not a conversation that's been had. And more broadly, I also know that there are other doctors suffering from other diseases, and we need to talk about this head on, face to face, in full volume, because it's so important. It's so important to look after ourselves. We need to know where to access care. We need to know what help is available. And we need to know how to deal with these things when they crop up in our lives, because you might not be dealing with something like this at the moment, but 5, 10, 15 years down the track, maybe this will be you. And if we can speak out and talk about this and make it easier for those that come after, if we educate ourselves and if we provide non-discriminatory and open healthcare, that it will enable not just patients to come forward, but other members of our profession that might end up with a diagnosis like this, then I think that's a job well done. What would I say to someone in the audience if they're HIV positive or dealing with some other illness? I would say ask for help, get support. Often the people that end up caring for us end up being our spouses or our other loved ones, and often they feel overwhelmed with the burden. It's important to get professional help. Don't hide away. Certainly in confronting this, and being open with myself about what it means for me and what it means for those around me has really enabled me to come to terms with it and to hopefully see some good come of it as well. It's now 8.5 years since my diagnosis of HIV. It's something that I've now been able to come to terms with in many ways. It's a part of my journey through life, and whilst it's one that I wouldn't necessarily choose to repeat, it's certainly opened up a new understanding for what it means to be a patient, and for what it means to be a doctor living with disease.